Good afternoon and welcome back. I hope you all survived what was obviously a very, very warm weekend. We have a lot to get to today, so I'm going to keep my comments very brief. One of the issues we're going to be talking about today is testing. Since the beginning of this pandemic, we've talked about the need to do more testing to get a better handle on this virus. In the beginning, our nation didn't have enough testing supplies, and we were very careful about not using up all of our tests and limiting it to the people who really needed them. Over the past several weeks, we've been able to increase our testing to the point where now, over the last 14 days, we've been able to average over 8,000 tests per day. However, as positive cases have surged throughout the country and demand has significantly increased for more testing by public agencies, hospitals, and clinics, it has led to a national and global shortage of testing materials, which is impacting us here locally also. We do have some good news to share with you today. We've come into an agreement with a local company that you're going to hear from in just a few minutes that will help stabilize our supply chain. But we must remain careful with these supplies. As a result, we will be modifying our testing approach a bit to focus more on priority groups like healthcare workers, first responders, and other at-risk groups for the time being. We will hear more on this subject from our Health and Human Services Agency Director, Nick Mascione, who also leads our county's T3 strategy. We'll hear from him after we get through the regular updates. To get us started, let me call on Supervisor Nathan Fletcher to go through the numbers.
Thank you, Chairman Cox. The number of COVID-19 cases are surging throughout the United States, and San Diego and California are certainly no exception to this rule. The potential for uncontrollable and exponential growth that could overwhelm our healthcare system.
Is undergoing.
How's that?
All right. You guys are good. I'll buy you an ice cream.
Obviously, we're having a few technical difficulties. We'll go back to Supervisor Fletcher in just a couple of minutes. But to give us the Public Health Director's report, let me call on Dr. Wilma Wooten.
Thank you, Chairman Cox, and thanks everyone for attending today's briefing. As is our practice, global, national, and statewide statistics are based on data that is obtained from the Johns Hopkins dashboard and was obtained today around noon. Based on reports through 11:59 p.m. yesterday, the County of San Diego is reporting its stats as follows. There are 20,348 cases, which is 419 more cases than yesterday. This includes a total of 422 deaths, with no new deaths reported since yesterday. The age range is unchanged, 3 months to 102 years of age. In making this essential milestone of breaking the 20,000 threshold for cases, I would like to just clarify who is actually counted among our positive cases, as there have been many unfounded rumors in social media. I'd like to stress that only laboratory-confirmed diagnostic positive tests are counted in our daily count for positive COVID-19 cases. The case total does not include suspect or probable cases or people that are on home quarantine unless they have been tested. And those people that are on quarantine have been exposed to a confirmed positive case. None of the latter individuals are included, again, in our laboratory-confirmed diagnostic tests. The number of confirmed cases that we report daily are just that, laboratory-confirmed cases only, and this is the recommended practice in the state of California. Also, the case definition is defined by the Council of State and Territorial Epidemiologists, and at our recent board meeting last week, there was a public comment which stated that I had changed the case definition. So I wanted to take the opportunity to clarify that that was an inaccurate comment, maybe a misunderstanding, but we have not changed the case definition. So continuing, there are 11,767, or 58% of the cases between the ages of 20 to 49 years of age, and again, this is slowly increasing. The gender is about the same, 51% female, 49% male. We have 2,052, or 10% of the total cases have been hospitalized. 538 of the total number of cases have been admitted to the ICU, and this is 3% of the total number of cases and 20% of the total number of those individuals or cases that have been hospitalized. Regarding deaths, there are 422 total deaths, which represent slightly over 2% of the total number of cases. 186, or 44%, are female, 236, or 50%, are male. And 95% of those individuals that have unfortunately died had underlying medical conditions. As with positive cases, deaths attributed to COVID-19 are also included in the total number of cases, hence they are also laboratory-confirmed positive cases only. Our sympathies and condolences go out to the families of all of the individuals that have been identified as deaths due to this pandemic. And all of our information is found on our county's website, which is found at the bottom of most of our slides and on the sign in front of you. Now, let's quickly move to the results for today's 13 triggers. 3 of these triggers are abnormal. And you will see here triggers number 1, number 2, and number 11. In the next slide, we will start with trigger number 1, which is based on case rates. And as you can see, we are still abnormal, even though it's decreased slightly from yesterday. Basically, because of this elevated case rate, we are still on the state's county monitoring list. Next slide. So this next slide shows for the past 7 days the number of outbreaks, community outbreaks, and the metric here is no more than 7 outbreaks over the past 7 days. And as you can see here, our total number of outbreaks for community settings in the past 7 days is 17. In the next slide, it breaks out, and actually the next 2 slides, this one as well as this one, thank you. It shows the various settings or locations where these community outbreaks are located. And as you will see in the next slide, this shows the most recent, ranging from restaurants and or bars to businesses as well as healthcare settings. And in this next slide, this aligns with trigger number 11, which is related to case investigations, and this is due, by and large, due to the increasing number of positive cases that are reported on a daily basis. So we are mitigating this by bringing on more case investigators. We actually were on an upward trajectory since July 5th, but over the last 2 days are declining slightly, but we do have mitigation plans in place including hiring more staff and bringing on additional surge staff as well as temporary expert professional staffing. And in this last slide, I just want to remind everyone that it is important to understand that the pandemic is not over. The virus is still in our community and it is widespread. And we cannot emphasize enough that the actions that are listed on this slide are very important for curtailing or preventing COVID-19. And these include practicing good hand hygiene and sanitation, maintaining 6 feet separation, wearing facial coverings, avoiding crowded places, and staying at home if you are sick, and not gathering. So we encourage you to continue to practice these guidelines. It is with this and the actions that have recently been taken by the governor that we will get on the other side of this pandemic. Now, please welcome back to the mic Chairman Greg Cox. Thank you.
After a few glitches, we're going to try to go back to Supervisor Nathan Fletcher to go through the numbers. So Supervisor Fletcher, let's try it again.
All right, thank you, Chairman Cox. Hopefully you all can hear me now. Before we get to the numbers, we want to walk through a few things related to the governor's action today, along with the air quality situation as it relates to the fire aboard the naval vessel, and then just reemphasize the changes that are coming in surrounding testing. The number of COVID-19 cases are surging throughout the United States, and San Diego and California are certainly no exception. The potential for uncontrollable and exponential growth is certainly what we are trying to avoid. An overwhelming of our healthcare system would not only be the situation that we are desperately working to not have happen, but would also have tremendous economic distress on our local economy. And so that puts the state of California and San Diego County in a position to need to take additional actions now. One of the most challenging aspects of dealing with the coronavirus pandemic is the reality that you have to often take actions and steps before it is painfully or plainly obvious to you that you need to. If you wait until your healthcare system is overwhelmed, by that point, it would be too late. And that is why we have the metrics around cases, outbreaks, percentage of positives, and others that we share daily. Those are the metrics that we use in conjunction with the state of California to guide the difficult decisions that are being made statewide. And that's what's pushed the state of California to re-examine the indoor higher exposure settings that are highest risk. We saw the governor today taking action to try and slow the spread throughout California, in particular in the most impacted counties, those on the state's monitoring list, which includes San Diego. So in addition to reimposing some restrictions to try and slow the spread of COVID, we are also confronting the realities of challenges in our testing system based on both the increase in positive cases and global supply chain shortages that are impacting many jurisdictions throughout, that cause us to refocus our prioritization on testing moving forward. So let's start with the governor's action today. Today, Governor Newsom announced the closing of indoor operations in high-contact, longer-duration sections for counties like ours that are on the state's monitoring list. Because we are on the list, we have to adhere to the closure of indoor operations in the following sectors: gyms and fitness centers, places of worship, office settings for non-critical, non-infrastructure sections as identified on the website covid19.ca.gov, personal care services including nail salons, massage parlors, and tattoo parlors, hair salons and barber shops, and indoor malls. These entities must cease their indoor operations, and that will be effective at midnight on Tuesday night, so effective on Wednesday morning, and those statewide restrictions will be in place until further notice in counties like ours, which are on the state's monitoring list. The governor also made the previous statewide restrictions that we've already been subject to applicable to all counties in California around bars and restaurants. But they did, if we remember when we put in place the statewide imposed restrictions around bars and restaurants, it was for a 3-week period of time. Those have now been changed also until further notice. And so indoor operations, gyms and fitness center, places of worship, office settings for non-critical infrastructure sectors as identified at the state website, personal care services, nail salons, massage parlors, hair salons, and barbershops and indoor malls must all cease their operations starting Wednesday morning per the state of California guidance, and that will be in place until further notice. For those business owners and employees who are there, we feel tremendously bad about having to be put in this situation of starting you up and then having to limit your operations. Rest assured, I don't believe that anyone takes any of these steps lightly, and it is with a great sense of understanding that if we don't retain control of the spread of coronavirus, it threatens the entirety of our economy. And so these are unfortunate steps, steps that we're certainly going to have a negative economic impact on your business. But the things that the state of California believes we must do in order to rein in control of the spread so that we can hopefully resume and be in a good position moving forward. As Chairman Cox mentioned, the surge in positive cases is also impacting our testing situation. We have more sick people. We have more positive cases, which means we have greater demand on our testing system. That is being compounded by a global supply chain shortage with testing supplies and components. There's been an unprecedented run on the components and types of pieces that go into making these tests, and multiple jurisdictions throughout the world, but in particular throughout California and throughout America, are experiencing unacceptable delays in the time it takes to get an appointment, and unacceptable delays in the time it takes to get testing results. These delays negatively impact our ability to effectively contact trace. Testing is a key part. Testing, tracing, and treatment is a key part of our strategy to try and mitigate and slow the spread of coronavirus. And so because of this, many counties throughout California are shutting down testing sites. Many are closing existing appointments and reservations that have been made in order to try and reduce the number of tests they're doing to speed up the pace at which they can get those results and to reprioritize and focus on the highest priority folks in order to get testing. Because of the partnership we're announcing today with Helix, adding in 2,000 tests a day with a 24-hour turnaround, and you'll hear from their CEO, Mark Stapley, in a few minutes about this arrangement and what they're doing. But because of this effort, we are not having to cancel our appointments, and we're not presently having to cancel any of our testing sites, but we are shifting our priority. And so for new appointments being made, those will be focused on individuals who are symptomatic or individuals who are asymptomatic that fit into some of our priority groups like healthcare workers, first responders, those with chronic or underlying health conditions, or those living in long-term care facilities. And so by taking this approach to reprioritize our focus on symptomatic folks and asymptomatic folks who are in the settings I just described, we might see a reduction in the number of tests being done, but we do hope we can see an increase in the speed at which we're able to turn around those tests. Lastly, before we jump into our charts, I just want to share, everyone in San Diego is aware of the fire on the naval vessel in San Diego Bay, and our thoughts go out to the firefighters, the crew, to those that have been injured, and our heartfelt appreciation to all of those who are trying to contain the spread of this. It is never good to breathe smoke, and members of the public should assume that they are being impacted if they smell smoke or if their eyes are burning. The particulate matter from the fire as well could be a compounding factor for those who have or are at greatest risk of contracting COVID-19. Anyone with underlying health conditions such as asthma, those with symptoms, or even people who are asymptomatic, we encourage you to take extra precautions. At this time, our Air Pollution Control District is recommending that residents who smell smoke remain indoors with the windows and doors closed and to reduce physical activity to the greatest extent possible. The San Diego County Air Pollution Control District is working with our federal partners and the Navy to collect and analyze air measurement data at several locations, including Sherman Heights, Mountain View, Chula Vista, and El Cajon. And we are working both with our own monitoring along with their monitoring to record levels of airborne particulate matter from the smoke at a downtown air monitoring station at Sherman Elementary. The monitoring that's been done thus far is not demonstrating toxic chemicals, but the smoke concentrations we are experiencing based on the fire are certainly not healthy. We're working with the Navy to determine if additional monitoring or additional steps needs to be taken, and Dr. Wilma Wooten can always provide more information on the public health impact of these fires and the corresponding smoke. With that, let's jump into our charts for today. We will start first with a graphical demonstration of the restrictions on indoor activities. Again, you can see here in San Diego County, gyms and fitness center, places of worship, offices for non-essential workers, and the list of essential workers again are on the State of California's COVID website. Personal care, including nail salons, massage parlors, tattoo parlors, hair salons, and barbershops and indoor malls will all need to cease the indoor components of their operation starting at midnight on Tuesday, and those restrictions will be in place per the State of California until further notice. Our T3 numbers for today, we're reporting 6,542 tests that were performed. Again, that is above our goal, our 5,200 a day goal. It is below our 7-day average, and again, we expect these numbers to come down a little bit in the coming weeks as we refocus and reprioritize what we're doing. You can see our contact tracers and treatments remain in full force. Next, our percentage of positives. Today, we're reporting 419 positive tests out of a total of 6,542. That gets us at a 6% of our test rate positive. That is right in line with our rolling 14-day average. Hospitalization daily census, very modest change yesterday to today, essentially the same with ICU and non-ICU. This is COVID-related hospitalizations are essentially flat yesterday to today. Overall hospital system capacity, you can see there at 3,953 with the COVID in orange, non-COVID above that in blue. And then our ICU current utilization holding steady at 72%, 159 COVID-related, 352 other ICU-related folks. That concludes my section of the report. I will turn it back over to Supervisor Greg Cox.
As we mentioned at the beginning of this briefing, there's some big changes going on in regards to our testing, and to talk to us a little bit about what those changes include, I'm going to call up our Nick Massione, who is the director of our Health and Human Services Agency and is also in charge of our testing and tracing and treatment division, the T3 division. So Nick, if you'd come on up.
Thank you, Chairman Cox. And as Supervisor Fletcher mentioned, we're bringing on a new testing partner today, a company called Helix, that's going to be providing 2,000 COVID-19 diagnostic tests a day, 7 days a week. I'm pleased to introduce you in a moment the President and CEO of Helix, Mark Stapley, and he'll say a few remarks in a moment. Let me just mention something about Helix, who's a hometown team here in San Diego. They were formed in 2015 and focused on finding ways to improve the health of communities through population-scale diagnostics. The company operates one of the world's largest clinical next-gen sequencing labs, and it's based, as I mentioned, here in San Diego. While bringing on Helix is, in fact, good news for us, I want to be real clear and frank that it's not a testing windfall. Before reaching an agreement with Helix late Friday night, we were facing a real tough situation of needing to close down some of our county testing sites, locations. Well, that's not going to happen now. But the constraints we're feeling were not just uniquely the counties. Our partners, our local hospitals and community clinics, even some of the commercial labs are experiencing supply struggles of their own. And the news story after news story paint a very stressful and distressing picture about the national testing scene. And yes, in San Diego, our ability to test will stabilize because of this new partnership, but we're always looking to bolster our resources. In fact, that's how we found Helix. To best protect the public health, our focus now is moving to faster tests, and as Supervisor Fletcher talked about, focusing faster tests for people who need it most, our highest priority groups. While our county lab is achieving a turnaround of 24 to 72 hours, the waits of 5 or more days for results from other labs are just not acceptable. This renewed focus on priority populations will be a huge part of the T3 mission going forward. Dr. Wooten has spoken and Dr. McDonald has spoken in the past about why these individuals were the most important to test. More information on the priority population groups that you can see on the screen is available on our county website as well as the 211 website. And this one you're seeing is the coronavirussd.com. And it was actually updated as this press conference began. Now, here's where we need the public's help. The highest testing priority for the County of San Diego remains those with COVID-19 infection symptoms or people in high-risk groups that could include healthcare workers, first responders, and other social service employees, and people in essential jobs. Our transport, our folks delivering groceries and providing groceries. Older adults, people with chronic medical conditions, people living in residential in group settings such as long-term care facilities or shelters, and people exposed to infected individuals in places where COVID-19 is high. If you think you need a test, as we always said, first and always check with your medical provider. And if you don't have a medical provider, we're here to help. Call 211 and they will make you and help you get a referral to a medical provider. We know as this pandemic continues, many people are going to need to be tested. And with now this partnership with Helix, more of those priority groups will get their tests and get them even faster. And for those in need of an immediate test, we are operating our walk-in, no appointment clinic at the County Tubman Chavez Community Center located at Euclid Avenue. This Tubman Chavez testing site is actually our busiest site. It's open 7 days a week. It starts at 8:30 a.m. and will continue to serve everyone who's in line before 4:30 p.m. We're going to be adding more of these no appointment sites into the future throughout our county. Now with that, let me turn it over to Mark now to tell you a little bit more about Helix and their testing technology.
Thank you, Nick, for that introduction. We're excited today to announce our partnership with San Diego County to provide COVID-19 testing by leveraging our expertise and infrastructure to help in the fight against COVID for people in need. As you said, Nick, as part of this important public-private partnership, we'll be providing San Diego County with up to 2,000 COVID-19 tests per day. As Nick mentioned, we were founded in 2015 right here in San Diego, and we've got 5 years of expertise operating a clinical lab and collecting and processing samples at massive scale. So we're well prepared for this challenge. We intentionally built our lab from the ground up to be able to be highly automated and scalable, making it a unique fit for the ever-growing demand of COVID-19 testing. We've shifted the majority of our resources to this testing challenge to support this effort. While we continue to service our population genomics customers, we're incredibly focused on COVID-19 testing because it's needed by our community and around the entire nation. We launched our first test, the Helix COVID-19 test, in June in response to the growing demand around the country. It's a PCR-based test. And that includes a full non-invasive collection kit, which is processed in our clinical lab, and results are returned the next day. Let me talk a little bit about our actual test and how Helix achieves this. As I mentioned, in the 5 years that we've been operating our clinical lab, we built a scalable and automated technology, and the infrastructure to support that, and a very strong and talented team. We're continuing to invest in our facility, our infrastructure, and our team, and the technology behind it to service the demand as it continues to grow. Unlike many reference labs who have many different tests or versions of a test, at Helix, our COVID-19 test is highly standardized, and it's only one of 2 tests that we offer alongside our next generation population genomics test. And that's all that we do in our lab, which enables us to create a highly automated end-to-end solution with fast turnaround time. We are, of course, subject to the same supply chain constraints as other labs for some of the components and raw materials used in our testing. But as we designed our test, we intentionally focused on addressing some of those areas where we could avoid the existing choke points in the supply chain. For example, we moved quickly to recognize that not only is an anterior nasal swab, a swab that goes in the lower part of the nose, more comfortable for the individual for testing, but it is actually easier to procure as well. In addition, we're using an alternative transport media that does not require a cold chain. And what that means is it can be shipped and stored at room temperature, at ambient temperature, which makes the logistics of transporting, storing, and dealing with samples simpler, and it simplifies the supply chain massively. And then thirdly, later this summer, we plan on launching a second COVID-19 test. This test will be based on next generation sequencing, which is a massively scalable technology that we have years of experience with right here in San Diego. The test will be based on Illumina's NovaSeq platform, another life sciences company just down the road from us here in San Diego. As well as being more scalable, we believe this will be the most sensitive test on the market, or one of the most sensitive tests on the market. But more importantly, or as importantly and critically, it will have significantly fewer supply chain constraints because it requires a different reagent supply chain than the tests that are being run today. So in closing, I'd like to thank the entire Helix team for launching this COVID test so quickly, and the San Diego County team for working with us to get ready to provide testing in the way we've talked about. We're excited to be part of this important public-private partnership with San Diego County and to make COVID-19 testing available to those who need it most. With that, I'll hand back over to Chairman Cox.
Thank you, Mark, and what a great partnership with a local company, Helix. With that, let's go directly to the questions.
Mimi Alcala, 10 News. Please state your question.
Hi. So for hair salons and barbershops that have to shut down again, I've been speaking with a hairstylist who has a private back patio at their shop. Although it's not ideal, will they be able to give haircuts outside?
Okay, Dr. Wooten's going to respond to that.
Hi, thank you for your question. If I heard you correctly, yes, outside, if there is the capacity or the capability for salons or barbershops to do what they do outside or on the sidewalk, but again, that would depend on what permits or what exists in their various jurisdictions regarding the ability to do that through law enforcement. So they would need to find out what their local policies or capabilities to do that is before they can just set up outside.
Thank you, Dr. Wooten. And then my other question is, some businesses continued to operate during the first closure and didn't really face any repercussions. Will there be stricter enforcement with the latest restrictions?
Well, thank you for bringing that to our attention. Actually, there are two strategies or processes that we can utilize now. The state has a strike team capacity to deploy 2 jurisdictions throughout the state. We work with them through a group that we have developed or comprised to do similar work. So we are working out the details of utilizing our code enforcers in the county to go out and conduct assessments related to enforcement.
Thank you.
Mm-hmm.
Okay, let's go to the next question.
Freeman with the San Diego Union Tribune. Please state your question.
Oh, hi. Thanks for taking my question. Certain indoor shopping malls, I guess I'm looking for a definition of what that means. In North County, Westfield, North County, the shops at Carlsbad, those types of malls are open now on a limited basis. And I was wondering if this new order from the state requires the closure.
Okay, Dr. Wooten's going to respond.
Thank you for the opportunity to address this particular question. We've actually had discussions about this. We have not seen guidance from the state yet, but if, for instance, you have an indoor mall and the access is only from inside, if it is in the list that was provided by the governor today, then that particular business would need to be closed. On the other hand, if it is a business in a mall that has exit to the outside, then that business can conduct business via pickup or curbside, as we previously, before we opened up malls, as that was a practice that was previously in place. So we are going back, or as the governor likes to say, we are lowering the dimmer switch, so we are going back to that particular phase. Thank you.
Thank you.
Okay, next question.
Adam Rakusin, 10 News. Please state your question.
Yeah, hi. Thanks for taking my question. I have two real quick. I'll start with this one. So health researchers say despite current numbers, more testing was needed throughout California to get ahead of the virus. Supervisor Fletcher said that the county is trying to avoid uncontrollable growth. If we're not testing everyone, how do you expect to get an accurate picture of what's actually happening across the county and make significant strides to get ahead of the virus?
Okay, I believe Dr. Wooten's going to respond.
Thank you. You are outlining what the challenge is, and this is not a challenge or an issue for San Diego, but this is a nationwide challenge. And we were doing quite well in terms of testing throughout the community up to the point where a limitation in supplies resulted. So this is a nationwide issue, and we feel that we have developed as best a solution as we can. We've decreased our capacity or the capability just a bit, but not an exorbitant amount. We still are able to test, but we are having to scale back on that testing and just refocus where the priorities are, and those were stated previously by Supervisor Fletcher.
Thanks. And as a follow-up to that, just looking for a little clarity, the gentleman from Helix said up to 2,000 tests a day. What's that going to be at tomorrow? 2,000, 1,000? What are you expecting to receive from Helix starting as soon as possible?
Just one moment.
Thank you. So yes, as we mentioned, we can scale up to 2,000 tests per day. And obviously the utilization of those tests will be based on standing up our solution in individual sites. So we've already got it set up in one site, another site coming live, and then we'll just ramp up as quickly as we can with the county to make that available in other sites. We've already provided a number of kits, and they're available and ready to go for people who are in the most need for testing.
And I just wanted to add, as Helix has the focus that they have, our public health laboratory will then be left to focus on outbreaks throughout the county, including our long-term care facilities, as well as restaurants and other settings, business settings, so that we can focus on those and turnaround time quickly, so we can conduct the case investigations and then from there interview close contacts. Thank you.
Okay, we'll go to the next question.
Taryn Mento, KPBS. Please state your question.
Yeah, I just wanted to ask how the limitations of testing to those at higher risk would affect potentially the metrics that we are using to monitor when there is more COVID activity, and then possibly take further restrictive action. So how was that considered with the changing in testing criteria and guidelines?
Dr. Wooten's going to respond.
There is a multi-level process that's going on here. Maintaining the capability to test priority populations is important. But as we also layer on top of that, closing specific venues, particularly right now, all of the restrictions that the governor has imposed, what we hope to see with that is a decrease in the number of the widespread distribution of this virus. And as commonly, some people think that the more you test, the more you find, but really is what is in place is the virus is widespread. Whether you test, you will still have widespread distribution. Testing allows us to identify those individuals that are positive so that we can quickly identify contacts and get those individuals quarantined, isolate the individuals that have tested positive. That's the whole purpose for the process of testing, so that we can identify those individuals that are positive and remove them from the general population so we can decrease the spread of the virus.
Well, I guess my question is, will that allow us to fairly look back at earlier numbers when we're making a change with how we're testing now?
Well, very early on, we weren't testing enough. And then, again, no fault of anything going on locally. This is a nationwide problem. Testing materials were not available rapidly across the U.S. As those supplies became more available, jurisdictions began to test more based on the metrics established by the federal government and our state. We got there. Now we have another wrinkle, which is now a decrease in supplies. As I stated before, we have developed a reasonable good strategy to maintain testing. We're just having to refocus our priorities so that we get the most vulnerable populations tested. That really is what's important. And as contacts are identified, those individuals are quarantined, and if they need to be tested, they are tested appropriately. So, and in 2 months, we may have to change courses again based on the reality of what is going on nationally. Thank you.
Thank you.
Okay, we have one final call-in question.
Paul Sisson, San Diego Union Tribune. Please state your question.
Thanks for taking my call. Public Health has recently said that it will follow the data in determining which businesses or activities should be closed. As I recall, recently officials have said they haven't detected any outbreaks associated with personal services, barbershops, nail salons, tattoo parlors, etc. Has that changed, or is that still the case? And if that is the case, why is the county going along with the governor's order if the data doesn't indicate that these personal services have been a problem?
Okay, Dr. Wooten's going to respond.
Paul, looking at the data across the board, there are individuals that have developed COVID across all of the sectors you've named. While there might not be an outbreak, individuals are associated with those particular locations. So we are following the data, but also the governor and at the state level is looking at the entire state, not just the county of San Diego. And obviously, based on our increased number of cases, we are on the governor's watch list. And with other metrics, looking at hospital capacity, we are looking at that as well, where it might be coming to the point of being abnormal. So we have an increased number of cases, and there's no denying of that. And all of that information drives us locally as well as at the state level to take action. As stated, that's why we have our metrics for the triggers. And we have 3 abnormal triggers. So I think the actions that are taken are the actions to get us to the other side of where we need to be. Thank you.
You know, I've gotten a lot of feedback from folks in the public in recent weeks and months, just really desiring more information on exposures in different locations. Is there any way that the county could start publishing something regularly that just gives us a list of how many people have tested positive after visiting some of these various locations that are now the subject of regular shutdowns and reopenings and what have you?
So what we are planning to do, Paul, is on a monthly basis, because the changes might not occur so rapidly, but on a monthly basis, look at the various sectors where we have positive cases. So we will begin to do that this month.
One final question. It has to do with the concept of pooling and public health surveillance. I guess this is the idea where you would take multiple samples and combine them into one test kit. So you could say test 100 people with one test kit, and then if you got a positive, you could retest everybody in there. But if they were all negative, you would have saved a lot of test kits. Is pooling something that you guys are considering in terms of continuing to conduct surveillance, even as you're trying to conserve testing resources?
Well, that's a big if, Paul, and with the increased widespread distribution of COVID-19, we certainly are looking, and there are discussions with state officials about that, but we are not currently in the process of doing that. Dr. McDonald might have additional intel to share with you.
Yeah, thank you, Paul, for that question. And, we have a local testing task force. The leaders of all of the local hospital and other laboratories in the county have been meeting regularly throughout this period. And indeed, one of the major topics at our last meeting at the end of last week was this issue of pooling. And it is extremely difficult technical challenge, to be honest with you. It depends on the machines that are being used. Number one, whether it's technically possible to do this kind of pooling. And number two, it really depends on the actual incidence of positive cases amongst the number of samples that are coming in. It's a math problem to decide whether it's okay to pool, get a positive test, and then split that pool to then actually do more testing to find that positive case. And that question is actually something that is a lab by lab, population by population question. And our public health lab has looked at it and determined with our current platforms and our current rate of positivity, it doesn't make sense to pool. It may make sense to pool at some point in other types of scenarios, such as, say, in a large group of individuals who are starting a school, for example, who are at low risk to begin with and have no symptoms. That might be a good group to actually do a lot of testing and pool, because you expect the number of positives to be extremely low. But that specific tool is being looked at and certainly would be used if the appropriate population was identified based on the platforms that are available.
What is the main constraining variable there? Is it something like batch size and how many you can do at once, or what is the constraint with your equipment?
Well, again, it depends on each machine, and I'll maybe defer to a laboratorian to give you those specifics. But frankly, from the epidemiologic perspective, it's the number of positive tests expected based on the pooling. And when it goes above 4 or 5%, which we're at as a community right now, it doesn't make sense to pool.
You're just going to basically spend a lot of time chasing. It's going to be hard to find a pool that doesn't have at least one in it.
That's correct. And what you do is you increase the turnaround time, actually. That's the other thing. You actually double the amount of time, or even longer, the amount of time it takes to get a test. And as you've heard, turnaround time is an issue for us.
Thank you, Dr. McDonald.
Okay, that completes the call-in questions. The first text question deals with various apps that may be available for contact tracing, and Supervisor Fletcher is going to respond to that question.
That question is from Richard Allen with CBS 8. County health officials previously said they would consider developing a contact tracing app to track people via their phones. What is the status of this app, and how would you alleviate widespread concerns over privacy? How effective could an app like this potentially be in tracing and notifying people who have been potentially exposed, and what challenges are you facing in rolling out such an app?
Yeah, thank you. Thank you, Richard, for that question. We're very interested in pursuing a contact tracing app. Our public health folks, our testing experts, our public health folks have been in conversations with individuals at the University of California, San Diego, who believe that it could be a useful tool around notification of if you've been in close contact with individuals who become positive. It would, of course, have to be an app. You would have to purposefully download a new app and opt into the program. So there would be a clear step that individuals would take if they wanted to participate. If they didn't want to participate, then they wouldn't download the app. And if they didn't download the app, they wouldn't be in any way connected to the program. But at this point, the state of California has not signed off on any counties moving forward with the ability to do that. And so we're continuing to talk to them. We've had a number of conversations with them. I think they're working through a number of issues surrounding the deployment of this technology. And as soon as we get the go-ahead from the state of California, then we think that there's value in moving forward with something San Diego County-based. We're going to continue to work with the state and try and get their blessing to move forward.
Thank you, Supervisor. This next question deals with the very tragic fire on the Bonham Richard. And we're very fortunate to have with us today Bill Brick, who is the Chief of Monitoring and Technical Services Division for our Air Pollution Control District. So while this question is being asked, I'm going to ask Bill if he would please come up here and be ready to respond to the question.
Okay, and this one is from Claudia with Univision. How can smoke coming from the fire at the naval base affect vulnerable communities, especially those in National City where COVID-19 related cases are still high? What recommendations do you have for residents in those areas, and when will the county share what kind of particles are in the smoke?
Well, when we look at the stunning images of the fire, we see smoke billowing out, and so our best tracer really is the fine particles that come out of that smoke, and we can measure that real time at numerous locations in the county. And we've added 2 additional sites. We're looking at a 3rd to put on the naval base. Our recommendations are really the same for everybody. As these particulate levels get higher, we want you to reduce your exposure by staying indoors, and also to reduce physical activity so that your respiration rate doesn't get elevated and you don't bring more air into your lungs. So I'm not a health expert, so I'm not going to talk about the COVID part. It's really the same for all people with pre-existing conditions and things like that. So was that the whole question? So stay indoors and relax. So.
Thank you, Bill. This next question deals with youth sports, and we're going to ask Dr. Wooten to go ahead and respond.
And this one is from Brandon Stone with KUSI. What is the current status with youth sports competition? Will high school sports be allowed in the fall?
Thank you for the question about youth sports. Currently, there is no guidance about youth sports. We've had guidances from the state about youth camps, but no guidance on youth sports is currently available. And as you heard in today's governor's briefing, no new guidances for various sectors will be coming out soon. So we are still on hold for youth sports. What we currently do local is camps where students can assemble in 12 or less and practice but not engage in any competitions. So that is where we are at this point. Again, no guidance on youth sports at this time.
And Dr. Wooten, if you could stay up there, this next question is related to testing for asymptomatic people, and this one's from Guillermo with Univision. Regarding the new guidelines for COVID-19 testing in San Diego, how can asymptomatic residents not included in the priority groups get tested? Also, will the free testing sites continue to operate?
Well, I don't know if people can think back to 2009 when we had the H1N1 pandemic. Vaccines that were available were prioritized to certain groups. And so that's where we are at this point in time. Because of the decrease in supplies for testing, we are having to focus and prioritize on the most vulnerable populations. So that's where we are. There obviously will be some exceptions to that if these most vulnerable populations might be asymptomatic, for instance, if they are in a long-term care facility or in a group of first responders or healthcare workers. But for the general public, we are decreasing the focus on asymptomatics in that population and focusing on the first priority groups and our vulnerable populations.
This next question, Dr. Wooten, is from Lindsay Winkley with the Union Tribune. Are you able to provide more details about the county's code enforcement team that would be keeping an eye out for businesses that aren't following the region's public health order?
Yes, I shared earlier that the state has strike teams, and we have connected the state with our lead locally that will be working on strike teams that we will be developing locally to focus on enforcement and taking complaints that are being sent to us through email or other avenues so that we can investigate those, whether it's a business or other location, so that we can investigate any complaints of noncompliance. I don't have the full details right now, but as that process is developed, we will share that information with you.
And Dr. Wooten, this next question is from Jay with the Union Tribune. LA County health officials or director said today that school team sports can't be played without physical distancing. Have there been any rulings or guidances like that in San Diego? And if so, are they likely to be lifted anytime soon? A lot of football players would be interested.
So youth sports versus professional sports. Are you talking about professional sports or youth? I didn't hear.
Youth.
So again, I've just answered the question. Any guidances on youth sports? No guidance has come from the state to date. And as stated in the governor's briefing today, there are no future new guidances that will be coming out for a while until we can get our arms around the increased number of cases locally and throughout the state.
Thank you, Dr.
Okay, this next question, why don't you go ahead and read it?
This one is from Lindsay Winkley with the Union Tribune. Are you able to provide more details about the county's code enforcement team that would be keeping an eye out for businesses that aren't following the public health orders?
That was the one I think we just did.
Let me go back. Also, UT question from Brittany Mealing. The mayor recently issued an order to waive permits for dining on sidewalks and in parking lots. Will similar allowances be made for other types of businesses throughout the county?
Yeah, in the unincorporated area of the county, what we would encourage businesses to do is to get on the county website, stcounty.ca.gov, and then click onto the Planning and Development Services. They have guidelines establishing what the process is in order to be able to extend out into areas outside of the normal confines of their business. So that's the best thing that they can do in regards to getting the answer to that question. And I believe this last question has to do with the testing, both before Helix came into the picture and afterwards. And Nick Mascione, our Director of Health and Human Services, and our T3 czar is going to respond to that question.
And this one is from Mike Freeman with the Union Tribune. Helix can deliver up to 2,000 tests per day. What was the daily maximum capacity in the county before Helix?
Thanks for the question, Mike. The county public health lab was averaging about 1,500 tests a day. There were times when we spiked up actually well over 2,000, but we're about that 1,500, 1,700 per day.
Well, that completes our questions for today. We would remind everybody that is going to be adversely impacted by these new restrictions, including gyms and fitness classes. centers, places of worship, offices of non-essential workers, personal care, including nail salons, massage parlors, tattoo parlors, hair salons, and barbershops and indoor malls, that these new restrictions will go into effect at 12:01 on Wednesday morning. And I believe Dr. Wooten has an additional comment she wants to make on that.
Thank you, Chairman Cox. I just wanted to add and further clarify the question about malls. Indoor businesses that you can only enter them from inside will be closed, but they can put up curbside business. So they can do curbside, just not, again, you can't access them from inside. Those businesses, like for instance a Macy's that has outdoor exits, they can remain open. So just wanted to make that clarification. It's primarily the businesses where you enter them from the inside of a mall. They can do curbside, but they cannot do business by people entering them from inside.
Very good. Well, that concludes our questions for today. We will be back here on Wednesday at 2:30. And again, we would remind everyone, if you want to stay tuned or stay updated in regards to the latest information, you should get on our coronavirus website at coronavirus-sd.com. It's right here in front of me. And again, the media department will be sending out the normal briefings tomorrow electronically. Thank you, and we will see you on Wednesday.